spacious.
Hello, Dr. Barankin.
Hi.
Thank you for agreeing to interview with the Monsoon Journal.
My pleasure.
I understand you and your team have opened up a clinic called the Toronto Dermatology Centre that specializes in the treatment and prevention of skin diseases. Can you further elaborate in how your clinic serves the community as a whole?
Sure. We opened up our clinic approximately 10 months ago, my partner and I, Dr. Anatoli Freiman, and we've created one of the most comprehensive dermatology centers in North America. Our clinic is about 6,000 square feet, and we have medical care of the skin, surgical, laser, and cosmetic. We see all ages, all ethnic types, and all skin types. As well, we offer phototherapy treatments, we have clinical trials, and we have 2 plastic surgeons that work with us. So as far as skincare needs, as well as hair or nail problems, we are the experts in certainly the Toronto area, and in North America we're one of the most comprehensive centers.
Thank you. Is there any special concern for newcomers and to Canada, and especially what areas they have to be concerned of?
Sure. Newcomers to Canada certainly get skin problems that everyone else gets. So everyone gets rashes, and you can get skin infections, you can get acne or psoriasis, so there's genetic conditions you can get. But there are things that people who come to Canada particularly develop, and that relates to the dry climate that we have, the lack of humidity, and the long winters. So typically what we're talking about would be eczema, dry skin, itchy skin, and eczema. And so a lot of people who come from humid climates, from foreign countries, from say India or Pakistan or Sri Lanka or China, where it's more humid, they come here and our humidity is low, their skin starts to dehydrate and they get itchy, and then they develop eczema. So the big thing that we talk about with those patients is that they really have to moisturize in our climate. They need to turn down the temperature on their bath or shower. When they get out of their bath, they need to pat dry, and then they apply a thick moisturizer, a cream, rather than a lotion. And so they may have gotten away back home where it's humid without doing those things, but you can't get away with it in Canada.
Like you mentioned the need for precautions such as decreasing the heat of the shower and moisturizing. Are there any other precautions that you'd like to mention, especially during the fall and winter months?
Sure. The other thing that we talk about with our patients is certainly sun protection, and I think a lot of people with darker skin types or ethnic skin types are not used to wearing sunscreen, and we do encourage people to wear sunscreen for a variety of reasons, not only skin cancer protection, but also preventing fine lines and wrinkles, but as well, especially in darker skin types, brown blotchy spots, which are very common, and that's induced by the sun. So sunscreen is something we talk about. Moisturizing is certainly another thing that we talk about. And if they do develop any sort of skin problems, whether it's acne because they're a teenager, or they develop psoriasis because it runs in their family genetically, we'd certainly recommend that they go see a specialist and get expert care in their skincare needs. Thankfully, in Canada, people are covered by OHIP, or our provincial healthcare plan for Ontario, and in each province people are covered for their skincare needs.
Thank you. I also understand you're an expert at cosmetic procedures. We know that you perform all Botox injections. Do you want to elaborate on some of those services that you offer?
Sure. We offer quite a breadth of cosmetic services. So we offer Botox here, and Botox you can use for wrinkles that are due to movement, dynamic wrinkles. So that would be wrinkles that affect the forehead, the frown lines, and typically the crow's feet, the areas around the eyes. As well, as you get older, you typically lose volume in your face. So people develop more hollows in this area, and here their cheeks tend to sag down, and we can fill them out with a filler, such as a Juvederm or a Restylane. And these fillers are made of substances that are naturally in your skin, and we just plump out the skin again. We also have laser technologies. So our lasers will tackle things like laser hair removal for people who have excess hair, and that's a very common procedure. We do laser for people who have conditions like rosacea or sun damage, so they have redness, blood vessels, brown spots on their face, and lasers can be very effective for that. And then we have another laser called a profractional, which is a laser resurfacing for people who have acne scars or other scars or fine lines and wrinkles. And then we have things like, we do facials here, we have electrolysis, chemical peels, and microdermabrasion. The best thing to do is really to come on in for a consultation. We'll review things, see what it is that bothers you, what fits within your budget, and we'll figure out a way to make you look as good as you want to look.
Thank you. See that you wrote 6 books and you're extensively published. I was wondering if you have something right now that you're working on in terms of research you want to talk about. Sorry.
Yeah, I wouldn't say I have anything specific right now. I have a book that I'm sort of is underway for my 7th book. So I'm working with a resident in Edmonton on that book, and that'll be a book dedicated sort of more to family doctors who deal with skincare issues. So that'll be probably coming out in 6 months or so. And then I do a lot of write-ups, reports, case reports, papers for various journals, and I have various medical students and residents that I work with on those to help them get where they need to in life. And you know, I've sort of published what I needed to publish, but right. I'm happy to help out a lot of younger people who want to publish, to be able to, you know, get into the residency of their choice, to build their resume. So I still continue to actively publish.
Thank you.
Don't worry about that anymore.
Yeah.
Okay. Thank you very much.
Thank you for your time.
So like I said, we have 6,000 square feet here at Toronto Dermatology Centre. We're divided in a medical side and a cosmetic side. And this is our medical side that you're looking at now. We have 10 clinic rooms for medical consults. And be happy to show you a room if you like.
And, so now we opened up in December 2010. How much have you really achieved the goal in terms of number of patients visiting and all that?
We have grown tremendously. I can tell you, we have, not even getting into our patient base, which is large and growing on a daily basis.
Yeah.
Even the staff, we started with very few staff, maybe in total, including myself, 3 or 4, not including the doctors, and we're up to a staff of 13 now, just within the last year.
Do you have any plans for your 1 year coming up?
Our 1 year anniversary, yes, we have some nice specials we're going to offer to our patients. We actually have other dermatologists that refer patients to us for our full body phototherapy unit. It's the latest technology. We have someone on board that speaks Italian, Spanish, Russian, Georgian, so a lot of ethnics. So it's quite comfortable. For a lot of time and effort into determining what we will carry in our clinic, and we carry only the best medical grade skincare and products. With our silk peel machine, laser hair removal, profractional and BBL. The laser hair removal, which is the light shear duet, I can't show you because it's in use, but it's for laser hair removal, much quicker than most systems, very, very effective. And